Tarkin?
Yeah, Tarkin.
All right, so this is Tarkin. He was born. Let me show you how pretty he is. He was born prematurely, about a month, 6 weeks early, and he had a couple of issues. One, he had a little problem with a little tissue underneath his tongue, so they had taken him to a dentist and clipped that. And they had noticed that his head was off tilt, and he's been throwing his food up and having this neck spasm, which is sometimes called torticollis with a baby. He's had a little bit of physical therapy, but I saw him last week. Tell me your first name?
Lauren.
Lauren's mom and dad brought Tarkin in, and I checked him and adjusted him, and I thought, well, we'll just check him in a week and see how he does. And there's a couple of spots that he's been dealing with in his upper back and neck. So I'm just going to do this. It's called a Webster inversion technique to check what's called the writing reflex. So I'm gonna take him and just sort of turn him upside down like this. And what we want to see is his head to come straight back towards me, which is pretty much doing that. It's a little bit turn to that side. So I'm going to adjust him just lightly over here. Can you make sure he doesn't fall off my lap? I'm just going to take a little light adjustment here. One more time. There we go. We use a little technique called DNFT. It's just a pressure technique. Hey, buddy. And I'm going to check one more thing. We're going to get Dad not to bounce him quite so rough. Come on. Let's get it right there. Jam it. A little bit more. That's it. Good job. All right. I know you don't want that. All right. Let's check this again. That's better. See, when a baby is born, their head down normally, and that arching of their neck is what helps transmit them through the birth canal, and that's called a writing reflex. Hey.
He was breech.
Yeah.
He was sideways.
Yeah. So there's a lot of trauma being in that position. Him trying to be born in a breech position. Did you have to do a C-section?
Yes, sir. Or yes, sir.
Okay. So right now, so how, since he has had his first adjustment, he was spitting up and not resting. He's kind of fretful. So how did he do this past week?
He slept all night. We
Really?
put him to bed about 9, 10 o'clock, and then he'll wake up about 4, and he just wants his pacifier, and he goes back to sleep till about 7:30.
Is that how it's been being prior to me adjusting? No?
No, he would wake up like
Pretty consistent.
4 or 5 times a night. We were not sleeping.
Sleeping all night.
Oh, wow.
I'll tell you what, a parent who's fretful about a baby not sleeping will drive them crazy. And when they get to resting a lot better, I'm going to get it back to you. When they get to resting better, I mean, it's amazing. So, what I'm going to do today, what's today? Wednesday?
Yes.
What I'm going to suggest is that we check them Monday, and you all going to be coming in the mornings generally? So what I'm going to do is check him Monday and Thursday next week, make sure it stays balanced a little bit better. I want to kind of make sure his eyes are tracking a little bit better, and make sure everything is, leveled out pretty good. Right now, everything moved good. It seemed to, progress. He's made good results from the initial problem. I don't know why they would really want you to get with a neurologist. I don't see him having CP, but we'll monitor him. And if it's something that concerns you, then certainly do whatever you feel is best as his mom, okay? Well, let's just keep track of it and make sure he, develops properly. Being premature and having a breech presentation puts a lot of stress on the baby, and we see a lot of mechanical problems that develop as a result of that tension. We call that dispersed trauma. You'll find that as he grows up, the average child by the time they're 4 have had about 4,000 injuries over the course of their first 4 years. So we'll keep a close eye on him just periodically, just to make sure everything's good, and we'll make sure everything does okay. All right, any questions, Dad or Mom? Anything? All right.
Really.
Well, I'm excited. I'm excited for you. All right. Tarkin, I love that name. Where'd that come from?
Star Wars.
Star Wars, of course.
And she's the one that thought it up, not me.
All right. Tarkin, that's great. All right. So we'll see him Monday, and then we'll see him Thursday morning, and then we'll see how it goes from there. We'll probably go back to once a week if everything's doing pretty good. I just don't want that spasm to stay in there. I don't want you to have to worry about letting the physical therapist worry you.
Yeah.
Okay. All righty. Any questions? Any questions? All right. Well, very good. I'm excited for him.